When approaching retirement, leaving an employer's health insurance plan for Medicare can be a big step filled with uncertainty. For those approaching this step, they can take comfort knowing that a financial professional can guide them through options and explain what to expect. I'm Tim O'Mara with the Nationwide Retirement Institute, and this is Healthcare, Planning for Costs in Retirement. Anyone enrolling in Original Medicare Parts A and B, augmented with prescription and Medigap plans, will face a number of options. With the prescription drug and Medigap plans that supplement Original Medicare, there can be significant differences in price, in coverage, or both.
The first issue for someone to be aware of is the pricing of Medicare Part B. The cost of this is based on gross income from 2 years prior. The higher that income, the higher the premium. For some individuals, that number may go down over time as income is reduced, but for some people whose retirement income remains large, their Medicare Part B premium may also remain inflated because of premium surcharges.
In addition to the Part B premiums, both Medicare Part D, which is prescription drug coverage, and Medigap supplemental insurance have premiums that will likely change year over year. It's important to know that while supplemental Medigap premiums change, the plans do not change every year and are not subject to annual open enrollment. Switching policies can be challenging and can take place only under certain circumstances. Medicare Part D offers flexibility.
For many people, their healthcare needs don't remain static. Medication needs change, and appointments and tests vary year over year. The Medicare prescription plans offered by third parties provide someone with the ability to reassess and adjust their coverage levels every year, which can also impact cost.
Financial professionals can potentially help their clients with the mitigation of risk. The cost and coverages of Medicare is something that may impact a person's life virtually every single day of their retirement. Conversations about planning for healthcare in retirement can happen early and often between a financial professional and their clients. Those conversations can be improved when that financial professional has the right resources and information. In the final part of this series, I'll show you a tool from Nationwide that helps financial professionals gather the information they need and provides an assessment clients may want.